Hello, this is Dr. Krithika, Reader, Department of Oral Medicine and Radiology, SRM Dental College, Ramapuram campus. This is a short recap on dental management considerations in patients with renal disease. Patient evaluation and risk assessment. Evaluate and determine whether renal disease exists. Obtain medical consultation if the patient's disease is poorly controlled, if signs and symptoms point to an undiagnosed condition, or if the diagnosis is uncertain. Potential issues and factors of concern. Prescribing analgesics. Dosage adjustment is necessary, likely when GFR is less than 50 ml per minute. Avoid long-term use of NSAIDs in renal disease. Avoid narcotics in chronic renal disease because these drugs can cause prolonged sedation and respiratory depression. Antibiotics. Dosage adjustments likely to occur when GFR is less than 50 ml per minute. Aggressively manage orofacial infections with culture and sensitivity testing and antibiotics. Consider hospitalization for severe infection or major procedures. A loading dose may be required when infection and chronic renal disease are concurrent. Anesthetics. Dosage adjustments generally is not required. Anti-anxiety drugs. Dosage adjustment for single-dose benzodiazepine is not necessary. Bleeding considerations. Screen for bleeding disorders before invasive procedures. Pay meticulous attention to good surgical techniques. Excessive bleeding may occur in patients with untreated or poorly controlled renal disease. Use topical hemostatic agents. Blood pressure. Monitor BP closely because hypertension is common in renal failure, and refer the patient for physical evaluation if the BP is elevated. Chair positioning. If the patient is on antihypertensive medication, assist him or her to regain equilibrium in upright position before exiting the dental chair. There are no issues with the use of any other device. Drugs. Interactions, allergies are to be considered. Adjust the dose of the drugs metabolized by the kidney when the GFR is less than 50 ml per minute. Avoid nephrotoxic drugs, especially aminoglycosides, acetaminophen in high doses, acyclovir, aspirin, and other NSAIDs and tetracycline. Emergencies. Minimize the risk for emergencies by avoiding invasive procedures and long appointments if the disease is unstable. For patients receiving hemodialysis, first patient evaluation and risk assessment has to be done, and it is the same as recommended for conservative care. Also, the liver function tests have to be done to assess the presence of opportunistic infections in these patients because of increased risk of development of the carrier state with hepatitis B and C viruses and human immunodeficiency virus. Potential issues and factors of concern are the same as for conservative care recommendations, plus the following issues. Antibiotics. We should consider antimicrobial prophylaxis if abscess is present. Daytime appointments are preferable. Avoid dental care on the day of hemodialysis, especially within the first 6 hours and afterwards. Best to treat on the day after. Avoid the arm with AV shunt for blood pressure measurement and deliver of IV medications, drugs in the interactions and allergies of concern. Adjust the drug dosage based on the stage of the renal disease. Consider the use of corticosteroid supplements if required. Follow up. The patient who have had a chronic renal disease should be contacted to ensure that the post-operative course proceeds without any complications. Thank you.